Good afternoon. My name is Tammy Harrison, and I want to welcome you to our COVID-19 Awareness Day. We are so happy to be collaborating with the National Federation. And again, my name is Tammy Harrison. I'm the Executive Director of DeKalb Families in Action, Inc. And my co-host for today is Olinda Ricard Hodge. So take it away, Ms. Hodge.
All right, thank you, Tammy. We are so excited that you all are joining us today and very excited to have our keynote speaker today, Dr. Ted Lyons. Dr. Ted Lyons and his wife, Dr. Merica Lyons, are the current owners of ShotRx, which is the only African-American owned vaccination clinic in Memphis, Tennessee. He is a proud graduate of the Jackson State University and of the University of Tennessee College of Pharmacy. He has advanced studies in pharmacoeconomics and health science administration. He is also an ordained elder and holds an associate's in Christian Science from Sure Foundations. He has a recent Amazon bestseller, God in 30 Seconds. Dr. Lyons has been an immunization trainer for the American Pharmacists Association and has trained over 300 pharmacists in immunizations and vaccine preventable diseases. He has also coached and trained athletes for over 15 years. And they will all tell you that his favorite saying is, make the necessary adjustments. So we would like to give a warm welcome, Dr. Lyons. Thank you for being with us here today. And please let us be educated by all that knowledge that you have to provide. Thank you.
Thank you so much, Linda. Yes, you guys, this is my passion is definitely making sure that our communities are as healthy as possible. Health and wellness across the spectrum, not with just vaccinations, but with everything from diabetes to asthma, all of that has been my passion my entire career. But right now, of course, we're being attacked specifically by the coronavirus. It is attacking the entire world, of course, our country, but specifically the Black and brown communities. We are at highest risk for not only contracting coronavirus, but having the most negative sequelae from it. Because of a lot of things that we have that are underlying or comorbid conditions that exist already in our community, things like hypertension, diabetes, obesity, dyslipidemias, high cholesterol, those things already we have as issues in our community, and they predispose us to not only contracting the coronavirus, but then having negative outcomes from it. So my wife and I thought about what could we do to help combat this, and so we started ShotRx back here in March to specifically go out and have a not only standalone clinic that we do vaccinations in, but a mobile clinic where we can go out to every part of Memphis and the Memphis area to vaccinate. We are in every single neighborhood, with North Memphis, South Memphis, Fraser. We are in all the hoods. And right now I'm in one now. So if my screen pauses because it have a bad connection, it's because we're out here right now vaccinating. We're at the Bullies, Guns, and Violence rally. And we're vaccinated here at that rally. I just spoke with a lot of teenagers about being bullied and being in gangs and stuff too. So this is our passion. Taking care of our community is what we do. That being said, let's talk about coronavirus. The coronavirus is real. I hope you all understand that by now, that this is a real virus that's out here. It's not anything that's made up in fantasy land. We have millions of people who have been infected in America, and about 750,000. We're approaching 750,000 deaths as of this weekend in America from the coronavirus. And a lot of those deaths have been in our community, in our Black and brown community. So we want to make sure that everyone understands the gravity of the situation.
Dr. Lyons, you're muted.
All right, did he come back? There we go. All right. Before we get into any further into this, I want us to take a quick look at a video that let us understand kind of why we need to wear a mask and then what we should be doing. So if you would, please, Linda, show us the video.
I run a channel on YouTube that specializes in super slow motion footage. And I've actually shot something for you so we can watch it together if you've got the clip ready. So this is footage I shot. It's 1,000 frames a second, which is roughly 40 times slower than how it appeared in real time. And I just counted from 1 to 4. Those are the numbers you can see at the bottom of the screen. And I was blown away at the amount of particles that came out of my mouth, not only from the spit, sort of at the beginning of each word, but after I'm done with the word, particularly the word for, you can see like a fine mist come out of my mouth. And that was actually really surprising that I could see that with the naked eye, the particles that are so light that they don't fall. And I wasn't even shouting that loud. That was like a medium volume of talking there.
Yeah, I think what you've just shown is a graphically beautiful demonstration of the importance of wearing masks and face coverings, because as the film shows now, you're saying the same thing, 1, 2, 3, 4,
Right.
and very little is coming out from the mask. So, we say, and I think graphic demonstrations like you've just shown now really solidify that. One of the reasons why it's so important to wear a face covering is that we know now that about 40 to 45% of the people who are infected don't have any symptoms.
So you just heard Dr. Fauci say that about 40 or 45% of people who are infected don't have any symptoms. Gavin actually created this video back in last December. And so now we know that that's probably a lot more than that. It's probably about close to 50% of the people don't have any symptoms. And the reason being is because we have the Delta variant. With the Delta variant, people aren't showing up with symptoms, fever. They may not have the loss of those things that we initially were seeing people with before, when they were getting the original strain of the virus. We don't see that so much anymore. So we don't know who has the virus just by looking at them. This is why it's so important that we vaccinate and that we wear masks. As you saw on Gavin's video, and you can pull up Gavin Free on YouTube. He does all these videos. He has one on that same video where he's showing what a sneeze looks like. You'd always forever never want anybody to sneeze around you once you see that. But he shows you this so that you can see that just by even talking, you're putting particles out here into the air that float around. And with the coronavirus being an airborne virus, just talking can spread it. You don't have to cough, sneeze, any of that. Just by saying words, just like T and P words, B words, you're pushing extra air out. And as you saw up close, it sprays out. And I'm not even concerned about the initial spray. If you go back and watch that video, it's the particles after that just keep floating. That's what's community right now. When you're just kikiing, ha-ha at lunch and having a good time and you got your mask off, that's floating around. When you're just on the phone in the grocery store talking with no mask on, that's floating all around the grocery store, okay? And it's landing on surfaces. And the coronavirus can stay alive on surfaces for 1 to 3 days. So we are constantly being in a state of exposure while we're not vaccinated and while we're not wearing our masks. Masks are not so much about keeping stuff from coming in. It's about keeping people who may have the coronavirus from putting stuff out. And since we don't know who has the virus, everyone wearing masks helps protect everyone right now. So number one, we need to be wearing masks. We really need masks on. It needs to be mask mandates until we can get this community level down. I know some areas have them, some don't. But just to be safe, family, please put on your mask and wear it like he was wearing his mask. A lot of times you see people wearing their masks and they're wearing them like this. That's not what you want to do. You can still be putting out the coronavirus out of your nasal passages like that. You see people with them down here. That's not good. When you're resting your mask, take it off. We take our mask off, we fold them, and then we lay them down. If you rest your mask down here, just remember, you have been wearing this mask like this the whole time. You've been getting all this stuff, walking through stores, everything is all down here. When you do this, you just now took that and you're putting it back on your face. You may have just inoculated yourself with whatever was floating in the air, whether it's the flu or corona or anything else. So wearing a mask is a little bit of etiquette to wearing a mask. So you want to make sure it's over your entire nose, mouth, and chin area, and try not to wear it down here and then put it back on. That's masking. Masking is important, but masking isn't the whole key. The whole thing is getting vaccinated. We need to be vaccinated. The coronavirus is attacking us like never before. You can go to the next slide, Linda. The coronavirus is attacking our country like never before. A lot of people feel like that we kind of turned the corner and we may be nearing the end of the pandemic. We're in the middle of the pandemic. We're nowhere close to the end. Right now, even in our area in Tennessee, Mississippi, and Arkansas, we're in a tri-state area. In our area, we have somewhere around 1 in 9 to maybe even 1 in 11 people are contracting the coronavirus. In Tennessee, we have about 1.2 million people who already had coronavirus at least one time. We only have 7 million people in the state. So that's about 17% of the state has gotten the coronavirus. That's the same in Georgia and some other areas. I think DeKalb County is one of the top 5 counties in Georgia that's with coronavirus cases. So it's the same thing everywhere. We have to understand that coronavirus is attacking everywhere. It's in very high levels in a lot of places. And again, our folks are the folks who are at most risk, especially like in our Memphis area. We are a city that goes to church, goes out to eat, with a lot of warehouse jobs, teaching, education, hospital jobs. Everywhere we go and everything that we do in Memphis involves being around other people. And that may be the same in you all's area as well. And with that type of demographic, it means that it places everyone at a greater risk for contracting the coronavirus. So you need to be vaccinated. We have to get vaccinated. Thank God we have vaccinations that work. You know, we talked a little bit earlier about our different disease states that kind of predispose you to getting the coronavirus. And you'll see them there on the slide: obesity, diabetes, asthma, kidney disease. Haven't had cancer before. My sister's a breast cancer survivor and she's a dentist. And one of the saddest things I told her, I said, girl, you have become one of the sad stories, but success stories I had to tell about coronavirus, because she kept delaying getting her vaccination at first. And she's seeing patients every single day. And she ended up contracting the coronavirus from a patient. And so my sister, who has a brother who vaccinates people every single day, has contracted coronavirus, about 3 months ago. And I'm like, why? You could have come by, but we got her through it and everything. Immediately, 14 days after she got cleared from having it, she went ahead and got vaccinated, but it scared the life out of us because she's a cancer survivor and her immune system already isn't that great. So we needed to make sure that she gets vaccinated first and early. Same thing with all these other disease states: obesity, diabetes, asthma. They predispose you. Lupus, a lot of Black folks have lupus, and that's another one that I have about 8 lupus patients now that we are so glad they went ahead and decided to get vaccinated. Women who are pregnant, your immune system is down. It's down because you're carrying a baby and the baby can't have your immune system rejecting it. So your immune system is down a lot. And that's why the American College of Gynecologists, Obstetricians and Gynecologists says that they want you vaccinated no matter what the trimester is. First trimester, second trimester, third trimester, you should be vaccinated, okay? We have to understand that these disease states make us more likely to contract the coronavirus. So it's bad out here, okay? I don't want to scare you, but I do want to scare you. I want you to understand that this is not a joke. When I see patients every day telling me that, hey, my sister just got coronavirus in the hospital. My son is 22 years old. He's down. Our regional 1 is our medical center. He's at regional 1 medical center and he's coughing up blood. Those things are sad stories that we don't have to have when we have vaccinations that are out here and they are working. But people have all these excuses of why they don't want to get vaccinated. And I tell you, it's my mom has a saying. She always says, uh-oh, it's too late, and that's where we are right now. If you're not getting vaccinated, when you catch the coronavirus, uh-oh, it's too late. You may be one of these people who is not just going to be 14 days that you're ill. It's going to be you're ill, you go into the hospital and we have to put tubes in you. Or maybe you're ill, you go in the hospital, we put tubes in you, and then we pray that you wake up and you don't wake up. Those are the only outcomes for coronavirus. You either get sick for 7 to 14 days, which nobody wants to have that happen because that's no fun, or you get sick and go in the hospital, or you get sick and go in the hospital and never make it out. We don't want that, especially when we have vaccines that work. We have vaccinations that work. The other thing that's happening right now, we have our children being attacked. If you want, as an adult, do it for yourself, do it for our children. Right now, our children are representing about 30% of all new cases. That is not good. That's not even close to good. I was talking to a group last week and I told them, I said, you know, we used to cry and have candlelight vigils and everything else when a kid got hit by a bus in the neighborhood. Well, we have kids going into the hospital every single day with coronavirus. Here in Memphis, Tennessee, we have 2 children's hospitals. They're both, all the beds are full, okay? At St. Jude, at Labana, all the beds are full. No, we should be having candlelight vigils and everybody getting vaccinated at the vigil right now because our kids are under attack. Thank goodness we're about to have some vaccinations for the 5 to 11-year-old group to go along with those that are 12 and up right now that can be vaccinated. But that'll happen next week, hopefully. We'll be able to vaccinate those who are 5 to 11 years old with a different vaccination by strength. It'll be the Pfizer vaccination, but it'll be a lower strength. That'll happen next week, hopefully. But even with that, they're still going to leave the group 0 to 4 unvaccinated. And honestly, you all, it's still going to leave 5 to 11-year-olds unvaccinated because mamas and daddies not going to go out there and get them vaccinated. And that's a problem. Them not being vaccinated means that even though there's a solution for them, we're not availing ourselves of that solution, and they're still going to be at risk. We have to get vaccinated. If you could go to the next screen for me. The 3 vaccinations that we have out here right now are Pfizer, Moderna, and J&J. All 3 of them work, okay? J&J is the one that has the least effectiveness. It's about 76% effectiveness because it's 1 dose. So that's one that, you know, we recommend last. It's only if you're so afraid of taking the 2-shot series of Pfizer or Moderna that you only want to take 1 shot. Well, if you're going to do 1 shot, then at least get the J&J because it's going to keep you about 70 to 76% protected. That being said, Pfizer and Moderna, they keep you protected after your 2nd shot at a 90 to 95% level. And you really can't beat that. We have no other vaccination that is that effective at preventing a vaccine preventable disease. 90 to 95% protected. And so I get a question a lot of times, well, that means I can still get it. Yeah, you can. That doesn't mean it's 100% effective. We have no medication, none, no diabetes medication, asthma medication, or vaccination that is 100% effective. No such thing exists out there. But 90 to 95% effective, you cannot beat that. Then I'll go one step further with you when you talk about I can still get infected. Yes, you can. But let's talk about what's really happening right now. We have vaccinated 189 million Americans fully vaccinated. In those fully vaccinated folks, only about 20,000 people have still contracted the coronavirus and it's been bad enough to go to the hospital, or they've contracted the coronavirus bad enough and they've ended up passing. If you divide 20,000 by 189 million, you get 99.989%. That means it's 99.989% effective at keeping you out of the hospital and out of the grave. And that is what is important. Can you still catch it? Yeah, but I won't die. I won't be in the hospital with tubes running out of me. So it's possible, it's just not probable. It's not very likely. But if you happen to fall in that unlucky 5 or 10%, because we said it's 90 to 95% effective at preventing it, if you fall into that 5 or 10%, you're not going to end up in the grave or in the hospital, most likely, okay? So that's one of the things that I really want to drive home because it's one of the most frequently asked questions and people don't quite understand how that goes. So I'm gonna pause for a second and give you guys a chance to ask questions. Are there any questions that are out there, Linda?
You actually answered that question. The question was, what about the people who are vaccinated that are still getting sick? So
Right.
are there any, have you noticed any trends? Are they becoming, are there any particular things that are becoming more apparent with those individuals who are becoming ill after being vaccinated?
That's a very good follow-up question to that. So one of the things they found in this group that the groups that are still contracting afterwards, there's usually some underlying condition, whether that condition is age, meaning that when you're over 50, 55, 60 years old, your immune system already is not great. That's why we recommend that anybody over the age of 50 get a flu shot, because you catch the flu, you may not be able to fight it off. Okay. So that's one of the things you're already seeing, that is going to be some of the older folks, and I'll be 50 next year. So I got one more year of good fight left in me, but I'm not calling everybody over 50 old, but I'm just saying older folks over 50, your immune system is not as great as younger folks. It's just that simple. Also, you have people who tend to have other conditions, comorbid or underlying conditions. And we mentioned those before: your diabetes, asthma, cancer, kidney disease, lupus, any of those types of things, or you're taking medications that may decrease your immune system. So high dose steroids, some lupus medications as well, decrease your immune system. Of course, cancer medications decrease your immune system. All those types of things, they're seeing that most of those people fall into one of those categories. However, there are some people who your immune system just doesn't work well, and it doesn't produce antibodies well. And that's going to be part of that group too. And we can't tell that. We can't tell that just by looking at you, whether or not your immune system is going to produce antibodies great or not. However, for the most part, when you get vaccinated, the majority of the people, 90% of them, are fully protected. And that's what we're seeing real world.
Okay, another question here is, what about the percentage of effectiveness for people of color?
Right. So nobody's really broken that out into a study or anything like that, and it doesn't really count. I hate to put it to you like that, but it doesn't really matter, because here's the situation. When we look at the whole, everybody's protected. It's protecting Black folks, white folks, brown folks, green folks, purple folks. The vaccines work. And if they didn't work, we'd see Black folks represent about 11.9% of the population, and of people actually getting vaccinated, we represent probably about 8 to 15%, depending on what study you're looking at. So we would see that, oh, a lot more of them are getting ill and they've been vaccinated, when they're not seeing anything like that. So the thing about vaccinations are they work, especially your Moderna and Pfizer vaccinations, the two shot series. They work well. Moderna producing, again, I just had some people inside asking me which one is the best. I get that question every day. If you want to like really get down to it, Moderna would be your better one, in the sense that it makes 3 times the antibodies that the Pfizer vaccine makes, and they last longer or persist longer. But in the real world, we're seeing it's only about a 2 or 3% difference in effectiveness, where Pfizer is 90 to 93% effective, and your Moderna is about 94.5 to 95% effective at preventing you from ever even contracting the coronavirus. But the key, they are both 99.989% effective at keeping you out of the hospital and out of the grave.
Okay, and a question that kind of goes along with that related to, is there any difference based on blood type?
No, they initially thought that came out. It was 2 studies that looked at that, and they thought there may be something with the phenotype of the blood and everything that may make some people more protective than others, and that didn't turn out to be the case. So no matter what your blood type is, you can catch the coronavirus, and the coronavirus can affect you negatively. It can affect you whether it be mild or severe. It can infect you and affect you.
Right. Okay. So you mentioned that individuals who have certain diseases are more likely and have a greater risk when they contract COVID. So there's a question here about individuals who may have blood clots. Is it safe? Would it be safe for them to actually get the vaccine? Or are there any illnesses that an individual might have that they should be cautious about becoming vaccinated?
All right. So your main one is going to be the blood clots, and that is going to be one. If you have blood clots, then you may want to steer away from the Johnson & Johnson vaccination, even though when they researched the blood clots associated with J&J, it was not at a level that was significantly more than what you would normally see in those age groups and in those disease states, but they still put the warning on there. These 3 medications are the most watched medications in the history of America, not just vaccinations. They're the 3 most watched medications. So when J&J had that group of 6 people out of 6 million get blood clots, they held the whole thing up. They held up their whole rollout and giving vaccinations. We held it up for 3 weeks with J&J just to make sure that there was nothing that was significantly more. Did it happen? Yes, but was it significant outside of what we would normally see in that population? And it was this much more. But they still went ahead and said that. And we still say to this day, if you have blood clots, let's choose one of the other two. We don't even want to give you a chance to have a problem. So let's just choose Pfizer or Moderna if you have a blood clot issue. Other disease states outside of blood clots, there's not really any that that you would really worry about. Some folks with Guillain-Barré syndrome had worries, or with Bell's palsy, they were wondering if they may have an increased risk of getting exacerbations of that. And there's not a significant increase in risk. And then also, this is the other thing we do in public health, and this is why this is really about public health. We look at risks to benefit, okay? So the risk of you contracting coronavirus and having a negative outcome is much larger than any risk of any of those other things. So that is why you still want to go ahead and get vaccinated. And when we're talking about a risk, let's go to the one where a lot of people heard about, the myocarditis, which is the inflammation around the heart that some people can get temporarily, and is usually going to be young men that could possibly get that if they're vaccinated. That rate or that risk is 1 in 100,000. Okay, so that would be like you all in there, Atlanta, at you all's football stadium. That would be like if everybody in you all's football stadium there to be watching Atlanta Falcons, everybody's there, that about 2 people, 1 person out of the entire stadium, if everybody was vaccinated, would end up possibly with a temporary inflammation around the heart that is resolved in about 2 weeks or so. All right, that's the vaccinated people. Unvaccinated people who catch coronavirus, guess what happens? They get myocarditis. It is not generally resolved, and it's at a rate of 1 in every 1,000. So in that same stadium, if everybody's unvaccinated but caught coronavirus, that would be 100 people that would possibly end up with myocarditis that is unresolved. So risk to benefit ratio, would you rather be in a group where maybe 1 in 100,000 could possibly catch it, or 100 could possibly catch it? You want to be in that group, okay? Especially since it's saving your life and preventing you from getting coronavirus altogether, all right?
Okay. Yeah, so that's really significant. Again, of course, there's still the concerns about the fact that the vaccines came about so quickly. And a lot of times there are medications that come on the scene and we've used them for years. Different products we've used for years, and it took years for them to discover that it caused cancer or any other symptoms. So what do you say to someone who has those sorts of concerns about how quickly this medication came about, and we don't know what the long-term effects of the medication is, of the vaccines are?
Let's split that up and talk about how quickly it came about. And Linda, don't let me forget the second part of the question, okay? Because I'll start and I'll end up forgetting. So first of all, how quickly they became about. So first of all, didn't come about quickly. What happened was this: the technology for mRNA vaccinations has been around for about 10 or 15 years. It is very, very expensive though. And that's why it's not normally used to make vaccinations. It's only been used 2 or 3 other times. And it was for some small viruses, vaccine preventable viruses that were out there. And so they used it. It's expensive. They put it up on the shelf. This is way too expensive to do. However, we had a pandemic that was killing the entire world. So the whole world put money in and said, hey, use whatever you need to use to get us a vaccine to save the world. So the money was there. When the money is there, also the minds are there, meaning more scientific minds came to attack this problem. It's kind of like if you're in a production, we have a lot of production here in Memphis. So if you're at the Hershey plant here in Memphis and you're making Hershey bars, if you got 2 people running the production line, it's going to take a long time to get 1 million Hershey bars out. But when it's 20 of them online, you can push that through pretty quickly. Everybody can get the job done. Well, instead of having 2 scientists or 2 companies working on this, you had hundreds of them working on it, and they were able to come up with what we needed for the mRNA vaccination to even be effective, which is the code, the sequencing code for the RNA of the virus. Okay, tell you right quickly how a virus is structured and what we use to make the vaccination. So a virus is nothing but a strand of RNA, okay? RNA is made up of proteins. Proteins are made up of codons. Codons are made up of bases. Give you a whole lot of immunology in about 60 seconds. So those bases those base codes are what we use to determine what makes up that protein. When we look at the coronavirus, that slide that we had before, you saw all those spikes sticking off of the virus. Well, every coronaviruses are a family of viruses. Every coronavirus has those little spikes on it. So when they were trying to decide what part of this virus will we attack and make a vaccine for, they said the spike is the one that's out there on everything, on every coronavirus. Let's attack the spike. They found the sequencing code. They found that code for that spike. That spike is the mRNA code that we then attach to the cholesterol that then goes into the shot in your arm. When it gets in there, your body has cells. Your cells in your body has a nucleus. That nucleus doesn't allow anything in it that does not belong. So when people tell you, oh, it's changing your DNA, no, it cannot. The DNA that's in the nucleus cannot be infected or affected by this vaccine. Why? Because the ribosomes that exist out in the cytoplasm of your cell, that capture that mRNA. mRNA is then used to make proteins. It makes a spike protein that is then released from the cell and destroyed by your cell's immune system, your body's immune system. Your body's immune system has B lymphocytes, T lymphocytes, and memory cells, as well as interferon that are released to destroy it. But the antibodies and the memory cells remember what that spike looked like. Therefore, whenever you come in contact with any coronavirus, whether it's the Delta variant, the UK variant, the original variant, or the original virus, it's looking for that spike. It's not looking for the whole virus. It's just looking for that spike. And those antibodies fit like a lock and key. They lock onto that spike. That then tells your body, hey, antibodies have a hold of something. Get rid of it, because anything an antibody attacks, we don't want. Your body shuts it down, kills it, disposes of it. That keeps you from getting the coronavirus. The way to think about it is like this. Vaccines work like if I were to tell Alinda that, hey, it's going to be a guy in a green shirt and green shoes try to rob your house tonight. Alinda pretty tough. She going to take care of him. I know she going to handle him pretty good, okay? I'm not worried about that. But Alinda would probably like for me to also tell her brother, sister, cousin, uncle, auntie, and all her best friends, and they sitting in the front yard waiting on the same guy in the green shirt and green shoes coming to rob her house. That's what a vaccination does. It tells your body, this is what the culprit looks like. When you come in contact with it, you can go in the grocery store, breathe it in. You can touch something and touch your face and get coronavirus in. Doesn't matter. Your body already has the antibodies waiting in the front yard and is ready to fight it. So the moment you breathe it in, take it in, it takes care of it. It gets rid of it. And then you don't get sick. You don't end up in the hospital. You don't end up dead. If you don't get vaccinated, it takes your body 1 to 3 days to make antibodies to fight off a virus, any virus. I don't care what it is. It takes 1 to 3 days. Your adaptive immune system does not kick in instantly. It kicks in 1 to 3 days. That's okay for some folk, not okay for most folks. If you have any underlying condition, if you get a large inoculation of the virus, if you have cancer, if you have just your immune system doesn't work too well, that virus gets to grow for 1 to 3 days, and then you start fighting. You might lose that fight. That would be like Alinda knowing that the guy coming to rob her house, but she don't set her alarm clock. And then he over top of her hitting her in the head and wakes up and say, oh, I might want to fight him off now. It's too late. It's too late. If you're vaccinated, you already have the antibodies. They are already on board looking out for you. You don't have to worry about that. That's how vaccinations work. Okay. Now, what was the second part of the question? Then I told you I forget.
Long-term effects of the vaccine.
Long-term effects of the vaccine. So no, we don't know the long-term effects of the vaccine, and that's because we haven't used it long-term yet. However, we have used it for about a year already, plus the clinical trials that we had before. Again, I told you, there was no rush to make this medicine in the sense that we cut out some steps or anything. The most important step in any drug trial, any medication trial, vaccination trial, are the safety and efficacy steps. And those safety steps were still taken. They still had to make sure it was safe before we could start giving it to anyone, even the volunteers in the study and everything else. So what happened was you had a whole lot of first responders, doctors, nurses, pharmacists, firemen, policemen, everybody say, hey, we'll go first. We'll take it first. In the Pfizer trials was about 20,000 of them. In the Moderna trials was about 30-some thousand of them. Say, hey, we'll take it first. They went ahead and did that. And we saw that it was so effective in preventing the virus in them. We got an emergency use authorization. And that's what we had for Pfizer, for Moderna, and for J&J first, was an emergency use authorization. Now, of course, you know that Pfizer has gone on and become FDA approved. Moderna will be FDA approved before the end of the year. It just takes a while for the 7 people at the FDA who read all this stuff to read the 300,000 pages of, I mean, it's literally 300,000 pages of science they have to read about each one of these to go ahead and approve it. So Pfizer's done, Moderna will be next, and then J&J will be after that. But that's kind of the process. So the long-term effects, we don't know them all. We never know that. I want you to understand that. We have been given medication in this country for hundreds of years, okay? Some of them we had to take off the market because we found out this does not work, is not worth the risk or any of that. It's causing problems. But the 20, 30,000 that we still have on the market, medications we have on the market, they're on the market because they work and they don't cause things at a great level that end up harming you for good. You know, anything that's going to cause you cancer, they're not going to let it stay out there on the market. Anything that may cause a heart attack in too many people. Now, understand something. I always tell people the truth. I've been a pharmacist for 24 years. Anything we put in our body that is not water or naturally organically grown, it doesn't belong in there. So when we're using a medication, we're giving you something because something's wrong with you, okay? Or we're trying to prevent something from being wrong with you. So if in the case of diabetes, for instance, we're giving you a medication to help you control your blood sugar because your blood sugar is out of control, whether it's because you were born with your pancreas not being able to produce enough insulin, or that you've gotten to the point where you've eaten wrong for a long period of time and you're obese and now it doesn't work well in your body. No matter what the case is, we're giving you a medicine to try to fix a problem. That medicine may have some side effects, but the problem will kill you. The problem will cause you more problems than if we give you the medication. Same thing is happening with this vaccination. The vaccinations are safe. Everything we've seen about them is safe. The only side effects that we've seen are of any great concern are, one, your arm's gonna hurt the next day. Everybody gets that one. That's actually a good thing. It means your lymphocytes are coming to that area, doing what they're supposed to do, making antibodies. It hurts for a couple of days. Next thing, you may, 30 to 40% of the people may get a headache, feel like they're coming down with a cold, or feel very tired for 1 to 2 days. That happens. That's your body building up antibodies to get ready to fight off the virus. That may happen. The other things, we already talked about them. Possible myocarditis in certain groups, possible blood clots in certain groups. We've seen those at a very low level, but even though it's at a low level, we're telling everybody about it. You normally don't hear about any of this stuff with medications because they're at such low levels. It's not until they get at a high level that you normally even hear anything about it. But we're reporting this stuff and it is still at such low levels because we don't want to hide anything from anybody, let anybody think that something's going on wrong. They are telling us every single thing that's going on with this.
Okay, and I think one last question, just so you can reiterate it. I know you mentioned it earlier. There's still, some rumors and concerns about the death rate of those who are being vaccinated. So what data can you give us about, has anyone died who has been vaccinated? And if so, what have we learned from their deaths?
Right. So let's make sure we understand what we're saying here. So first of all, no one has died from the vaccinations. The vaccinations haven't killed anyone. They have not caused a death at all. Have people died from coronavirus or other things after taking the vaccinations? Yes. So one of the things, we had some people who had died of heart attacks and what was another one? There was another one, something else. It was a heart attack and something else. Can't think of it right now. But that was because the person was 70 some odd years old. Another one was 80 some years old. Once you pass the age of 70, if you look at statistics, I hate to say this because I know some people that's 70 years old or older on here, but the chances of you dying daily increase the moment you hit 70. It's just a fact of life, y'all. It's nothing you can do about that. Whether you take the vaccination or not, once you hit 70 years old, there's a high chance that something may happen where you pass, okay? So you saw some of that in those groups, okay? Also, you find out that when people are taking the vaccination and everything, they are not, well, to go back to the number I gave you earlier. Remember I gave you the number 20,000, around 20,000 people have taken the vaccination and they've ended up in the hospital or they've passed away because they still contracted coronavirus. That is the number that you really want to look at right there. When that number, if that number were to start to grow and get to up to say 1 million people were passing and still taking the vaccine, we'd worry about that. But if you do the simple math right there and you say, okay, there are 189 million people who've been vaccinated. For 1% of those people because that's when we really start worrying about stuff, is at 0.5% or 1%. So you worry about something at 1%. 1% of that would be 1.89 million people. Until it gets to 1.89 million people have died or gotten really, really sick and they still were vaccinated and they still contracted, you wouldn't really worry about it. But here's the thing, they are watching it and we're nowhere close to that. They are looking at this and it's nowhere close to that. There are 750,000 people who have died because they haven't had the vaccination in America. That's what we're worried about. And that's what we're trying to prevent.
Thank you so much. Thank you so much. There is a question that I have to ask. It's because a friend of mine had this situation. His sister had the vaccination. She's actually a nurse. Then she had another medical procedure. And then she became very, very ill. Are there any recommendations as to how soon after having a vaccination should someone have any other medical procedures done? Is your body more susceptible to, other diseases, or is there any concerns at all around that?
Not like that. No, your body's not more susceptible to any other disease or anything after being vaccinated. No, what we're concerned, the one thing that we are concerned about after being vaccinated, if you're having any type of, say, a MRI or a radio contrast, say X-ray being done of your lymph nodes, like even women who are going to get their mammogram, you don't want to do it soon after being vaccinated because your body is ramping up to make those antibodies that we talked about, have inflammation showing up on those screenings, those scans, that imaging, and it can make us miss something like cancer or something else that's coming up because you've had that vaccination. So one of the things we ask you when you're coming in for that imaging, have you recently taken a vaccination? And that's any vaccination, but definitely even with the coronavirus vaccination, they're asking that because it can distort or give us a false reading on the imaging. Other than that, no, there's no worries about that. It's not like the vaccination will make you more prone that a negative sequelae will happen if you're going in for a surgery or for a procedure. That's not a true concern.
Well, thank you so much, Dr. Lyons. I don't see any other questions in the chat at this time. Are there any other closing remarks or statements that you would like to make? But we certainly do thank you for taking this time, and we know that you're the sole person giving vaccines today. We don't want to take up too much more of your time, but feel free if there's anything else you would like to say.
Yeah, I just want to let everyone know, look, you all, it is so very important that we get our children vaccinated and we get ourselves vaccinated. I know you all in Georgia are pushing hard. This federation, you guys are doing an awesome job of getting the message out and everything. Continue to do that. Also, you guys, the myths that are out there that your kids are seeing on TikTok and YouTube, they are myths. They are put there to scare you and get your feelings all going. I tell people all the time, feelings ain't facts, okay? Let's stick with the facts. Nobody's putting a chip in your arm. If they want to track you, their phone that you won't let go of, that's how they track you, okay? They can do that every day, all day. There's no zombies being made out here. I took my vaccination in February. I haven't eaten a single brain. I'm not dead. They didn't hit the 5G button and I'm dead. My phone says 5G right now. I'm not dead. I'm talking to you. So that's not happening either. No magnets can stick to your arm. Go find somebody vaccinated and try to stick a magnet to their arm. It's not going to work. All that stuff is a bunch of make-believe to scare people away from being vaccinated. Don't let that end up being you. Again, I see every day horrible stories. A good friend of mine, his twin cousins just passed away. Got another young lady, her mom passed away yesterday, hadn't been vaccinated, wouldn't get vaccinated. That young lady is what, 15 years old, you know, and now her mom is gone because she wouldn't get vaccinated. We don't want those stories anymore when you can simply just get vaccinated. We really, really need to get our folks vaccinated. And I hope you hear my heart.
Yes, sir. Yes, sir. Thank you so much. And we do have some words of gratitude in the chat for you. Just as great information. And thank you again for taking the time out today to educate us on the vaccine.
All right. Y'all be blessed. I'll see you next time.
You also. Thank you.
All right. Bye-bye.
Bye-bye. Okay, thank you. So thank you so much to Dr. Lyons. Ms. Tammy, is there anything you wanted to say at this point as we move on and introduce our other presenters who are going to give us some information about their agencies and what they're doing in the community? You're muted. You'll have to unmute yourself, Ms. Tammy.
Okay, I'm sorry about that. I just wanted to echo what Linda said. Thank you so much for Dr. Lyons giving us more information. I'm just encouraging everybody that's on today to please share the video. We're going to be posting it so that we can continue to get the information out to the end of this event that we're doing, which I think the end of it will be like the end of November. So we'll still be able to post, and when people watch the videos, please make sure that you fill out the link, the survey link that's also attached to it. So we're going to continue with the presentation. Thank you so much, Linda.
Okay. At this time, we'll have Ms. Suzette. She is going to tell us more about her agency. Ms. Suzette Brown.
Okay, I'm on mute here. You hear me?
Yes.
Yes, ma'am.
Okay. Well, I am Deborah Suzette Brown, and I am the CEO of Each One Teach One. I just want to just quickly say that I remember hearing a sermon from Bishop T.D. Jakes that talked about passion versus purpose. And my passion for my supporting grandparents, raising grandkids and kinship came from my history of going through my first marriage with my husband, very traumatic. I ended up being depressed, and I ended up having, my mother asked me, would you like to have your Daphne come and stay with me? And I didn't want to, but I had to, because mental wise, I was not there. So what I did was I let her go. She ended up staying there about 5 years, and it broke my heart, but it was something that helped me. And just a few years ago, in 2018, I had an epiphany that I really want to, because I started meeting a lot of grandparents, raising grandkids. And I just want to give you all some stats here for Georgia. There are 319,766 children living in homes where a relative is head of household. There's 100,000 children being raised by kin with no parent present. There's 3,798 children in foster care being raised by kin. There are 95,248 grandparents responsible for their grandchildren in Georgia. And for one child raised by kin in foster care, there are 28 being raised by kin outside of foster care. And most of the ones that are out of foster care, they do not get any type whatsoever of financial assistance. That's where Each One Teach One comes in. We're here to try to get money and try to grants and support mental health support groups to assist these families. There was a mother I got a call last week, a grandmother, 3 kids. She is walking to the food pantry in East Point to get food. And the young lady from Fulton County said that she says that it's so cold and she has arthritis. So I told her I'm going to get her a MODA card. I'm taking a MODA card on Monday. And it's just not enough funding out here. But that is my passion was doing this, but my purpose is to make sure that I assist families that are in the same situation as I. We're non-judgmental. And one thing I love is what Frederick Douglass says, it's easier to build strong children than repair broken men. Now, don't get me wrong. It didn't say that you can't repair a broken man. It says then it's easier. It's easier to build strong children than repair broken men. So if we start out with the kids very young, give them the support, the resources, and also with the grandparents do the same thing, it is very, the chances are that they will be more successful. And I just want to say to anyone out there, if you just think back when I'm 70 years old and I'm raising my granddaughter, she's 13. It was not something we planned. It was something that we were, I would say, destined for, because some things you're just destined for. And being destined for, I am every day just working harder and harder and harder and trying to find ways that I can support foster, adoptive, grandparents, and kinship parents, because that's what I feel like I'm here for. And if you all have any questions, I want you to go to my website. Take a look at the website. I have great partnerships with the community, Publix. I went to Sam's today, and I'm just trying to venture out into the community to get whatever it takes to be able to support these kinship grandparents, foster, and adoptive parents.
Thank you so much, Ms. Suzette, for the work that you do. That is some very necessary work. I'm actually a former foster care case manager, and I've worked with a lot of foster parents, and you're right, you know, it's important that families stay together. And yes. So that's an important service that you're providing. I don't see any questions in the chat right now, but I do encourage everyone to visit Ms. Suzette's website. It's in the chat, and it's right here on your screen. Take a photo of her flyer so you can contact her later. And again, thank you, Ms. Suzette.
You're so welcome. Thank you.
Okay. And I'm really grateful at this time. My name is Olinda, and I do have an opportunity just to tell you a little bit about who I am and what I do. I am the founder of Grassroots Business Consulting, and with that organization, I enjoy supporting my peers who are owners of different organizations or small businesses, helping to create the websites, helping to even do things like this to co-facilitate events. Thank you, Ms. Tammy, for giving me this opportunity. I'm also a trainer, a suicide prevention trainer. It's something that I am very passionate about. I work full-time for Viewpoint Health, and in that capacity, I work with suicide prevention. I support individuals one-on-one. I train the staff as well with suicide prevention. And we are able to come out if you're in Newton, Rockdale, or Gwinnett counties and train you and your staff and your loved ones for free. Suicide prevention is everybody's business, even children. I've trained at the Boys and Girls Club. And right now I have to let you know that our young people, even ages 8 and 9 and 10, are considering and even ending their lives by suicide. So it's very important that we get as many people trained to recognize the signs and symptoms. In September, I did host a free training and online. And if you're interested, please reach out to me and inquire more about that. I should have a training coming up in November. As I mentioned, I do support peers. I'm a certified peer specialist mental health. which means I use my own life experiences with my mental health challenges of depression, complex PTSD from a lot of abuse and situations as a child, as well as anxiety and my own suicidal history of activity. I co-facilitate suicide attempt survivor support groups just to help individuals have a safe place to talk about their feelings, why they're feeling that way, and develop new skills. I'm also an advocate, and I support parents as a certified peer specialist parent because I have children who struggle with their own mental health, some substance use, and even thoughts of ending their own life. So it's very important work to me, and I'm available if anyone needs to talk or is having some struggles with their children. So I'm really very open to supporting all individuals. I have a nonprofit called Sacred Families International, and through this nonprofit, it came about from my work as a foster care case manager, recognizing that parents weren't receiving adequate support. Even though we were focused on reuniting the children to the families, the parents did not receive the support that they needed as far as skill building. And sometimes, honestly, if a parent is struggling with substance use, they may need someone to hold their hand. And at that time, the foster care system was not doing that for parents, and I wanted to help bridge that gap. So I just wanted to just let you know that I am here. I am available to support you. You can reach me on my website, and that's www.sacredfamiliesinternational.org. You can request a consultation if you need some support in building your website or any other administrative support that you might need for your agency. And again, suicide prevention. So I just encourage you to reach out to me and we can have a discussion. And just really thankful again, Tammy, for giving us this opportunity to talk more about what we do for the community. So at this time, I'm going to turn it over to Miss Tammy, who's going to give us some more information about what she is doing in the community and what she has coming up and in store for us.
Myself. Can you hear me okay? I had to unmute myself.
Yes, we can.
Okay, awesome. Thank you so much, Alinda, for sharing the awesome work that you're doing in the community. I know you're a huge support for DeKalb Families in Action over the years. It's been a blessing just knowing you. Hope everybody gets an opportunity to check out my website. Alinda is the one who created my website for me, and she's a vast wealth of knowledge in various different areas. And so today we're focusing on the self-care piece of the program, because we know it's so important for our people that we're presenting to and the community to have information. You know, knowledge is power. And we want to make sure that if somebody is suicidal or is suffering with mental health because of this pandemic, and we know mental health is real, our mental health is very, very important to our overall health. And so, you know, we're really here to break down the stigma of mental health and share information. So again, my name is Tammy Harrison. I am the Executive Director of DeKalb Families in Action. We are in collaboration and partner with the National Federation of Families, which is the national organization, which I'm a local part of, and a lot of the presenters today were local chapters. That means we are taking responsibility to take our education and our passion and putting it back into our community to make sure that people who are suffering, they are not suffering in silence. So just a little bit about DeKalb Families in Action, Inc. We are a 501c3. We're located in Stone Mountain, Georgia, and we have been a nonprofit since 2012. I've really taken an initiative to really step out on faith and just do this work full time. My last place of employment was DeKalb Community Service Board. Before that, DeKalb DFACS, and the school system here in DeKalb. So with working for those agencies, what I found is that we do have some gaps in services. When we're dealing with families who are dealing with children who have mental health or possibly substance use challenges, sometimes they don't know how to access services. And so the reason why I stepped out on faith to do this work is because I'm trying to really step in and fill that gap. My background has been working as a liaison between the community and state departments and school systems. And so I'm just taking the knowledge that the Lord has blessed me with to kind of fill those gaps in and work with families who are in the trenches. And when I say in the trenches, I mean that we are dealing with a pandemic. We are dealing with people about to be homeless, families about to be homeless because, you know, they need support and they need help accessing resources for housing. There is a housing crisis in Metro Atlanta, Georgia, and it's real. So with that being said, DeKalb Families in Action, we provide support, education, and advocacy for children, young adults, and their families. We also work closely with other agencies in our community to provide services, share information. Our main goal is to connect families to access and resources in our community. That's our main goal. Our vision is to provide advocacy at the local, state, and national level. We want to provide leadership and network with other agencies and organizations. We want to collaborate with organizations to transform mental health and reduce the stigma. Our philosophy is a system of care philosophy, and the system of care philosophy is really about approach that characterizes multi-agency sharing of resources and responsibility by the full participation of professionals, families, and youth as active partners in planning, funding, implementing, and evaluating services and system outcomes. So we really want to be a part of that. And I really want to focus on the fact that if we really want to make change, we need to hear from the people that we're serving. These agencies are serving families that have mental health, that have other needs. So we want to make sure that we have a connection with the agencies to make sure that they're getting a clear picture of what happens when people are not receiving proper services in our communities. So with that being said, I really want to just focus on some of the services that we provide. We provide case management. I'm a certified peer specialist parent, which means that I have lived experience with raising children that had a mental health diagnosis or had challenges with behavior. We also provide transportation in the community. That means if people need to get to appointments, because of lack of transportation, if they need to get to the grocery store, if they need to get to pick up boxes of food, which we're going to talk a little bit more about. First Iconium Baptist Church was one of my partners with making sure since the pandemic started that we make sure that we have food boxes. And we've been doing that since the beginning of the pandemic. Also, I wanted to say that we also have certified peer resources in DeKalb County. We connected to Fulton County, Clayton County, Henry County, Rockdale, and Newton County. So we're growing. And so with that being said, I want to really encourage you to take a look at our website so that you could see more information about what we're doing, the collaboration and partnerships that we have. We have Christmas coming up for Toys for Tots, but most recently we have our next event, which is in November the 20th, is our next event, and it's called Call to Action, COVID-19 Call to Action, and it's going to be at 12 o'clock at First Iconium Baptist Church. We encourage you to get in contact and plan to participate in that event. I want to take our time to say thank you to Dr. Lyons for his dedication, for his knowledge, vast knowledge that he's sharing with us to to break down some of the myths that are out there about protecting ourselves through the COVID-19 pandemic. Also, I would like to thank all of our presenters for today. And last but not least, I would like to thank our sponsors. We are sponsored by the National Federation of Families, that national organization that we're all a part of, as well as I would like to just thank you for taking out your time to join us this afternoon. Thank you so much.
Tammy?
Yes. Okay, I thought somebody had a question. And so we're
Hey.
opening.
Yes,
now
looks
for
like
questions.
Reggie has a question or statement.
Oh, yes, Reggie, go ahead with your question.
Oh, well, I actually wanted to say, if y'all were ending, I just want to put my contact info in the chat. So I'm not sure if look and see who's on there, but I know I heard Ms. Brown speaking about some of the issues that the families were having, and I just wanted to say that put my contact info out there. I work for CareSource and Medicaid health plan, so I know some of the families that y'all have that you serve get Medicaid, especially if they get CareSource, and a lot of the services that they need, they can actually get access to. So if I always ask, tell people that when you deal with these families, first thing you ask is, do you have Medicaid, and if so, which health plan do you have, and have them start there. And I can put my contact information there, and if they have CareSource, you can definitely give them my info.
Yes, please do. And I know Teresa Wright Johnson is on. I would like for her to also put her information in on the chat moving forward for her organization, her national local federation chapter, so that we will have that information as well. Is there any other questions? All right.
Ms. Teresa, did you want to unmute and say anything, or did you want to go ahead and put something in the chat? I see where you said hello.
I guess I'll unmute and say something. I just wanted to remind everybody, I'm Teresa Wright Johnson, first of all, with Zaria Song, and we are also a Federation of Families chapter. I'm the executive director, as well as a parent peer specialist and a certified life coach and a certified parent educator. And I just want to remind everybody that there are some things impacting COVID and impacting us as individuals that we have not talked about. And one is domestic violence. And this is Domestic Violence Awareness Month that does affect our mental health and our physical and whole health. And I'm a domestic violence victor and domestic violence facilitator. At Zaria Song, we help families that have children with special needs. And one of the things that we're seeing is more and more families, women, feel trapped because they feel limited sometimes when they have a child with a disability in particular in a domestic violence situation. And during COVID, there's been an increase of domestic violence cases for families and just partners. So please be mindful and aware of that. And that's all I wanted to share today. If you want to reach out to Zaria Song, you can find us on Facebook, and I'll put that information there. And we have a new initiative called Irene's Dream. And it really honors my mother, because just like Suzette said earlier, I thought about it. My mother was a domestic violence victim and an evangelist, and she's the one that taught me how to help others, and we are all better together. So this has been a great event full of great information. Tammy, thank you for giving me the opportunity to be a part of it and to listen to our wonderful presenters today. Thank you.
Thank you, Teresa. And I'm so glad you talked about the domestic violence piece, because I do get a lot of calls about that. And we do have to share information amongst each other, because we all are in this work together. We support one another. And, one thing about it, I love what you said about working together, because we can't all do anything in silos. We have to support and help each other and collaborate with each other's organizations so that we can reach more people. And so thank you so much for my presenters, my colleagues, all the people that were able to join us today. And please share this post on your social media pages so that we can still get this information out to as many people as possible, so they can stop suffering in silence and be educated, because we know education is the key. All right. Thank you so much, everyone. Anybody else have anything we want to share before we end this presentation for today?
Thanks
All right.
again.
Thank you, everybody, and go Braves.